Thank you.
Yes, sir. Yes, thank you, sir.
Sir, good afternoon, and thank you everyone for joining in this awareness program this afternoon. Myself, Musrat Unisa, Assistant Professor, the Oxford College of Business Management. The Oxford College of Business Management, under the aegis of Children's Education Society, is one of the leading institutions founded by late Sri S. Narasaraju Garu, and the unprecedented legacy is being continued by our chairman Sri SNVL Narasimha Raju Garu. The Oxford College of Business Management's phenomenal growth translates the linkage between the industry and academia, research focus and prominent teaching fraternity into its consistent academic quality. The Oxford College of Business Management focuses on three core principles: education, research, and social participation, and we incorporate all three into our commitment with students and stakeholders. I welcome Dr. Nikita Allur, Principal, the Oxford College of Business Management, our speaker, Professor Dr. A. Murthy, Consultant Rheumatologist, Professor Jaisimha DS, HOD, UG Studies, Professor Sampath Kumar, NSS Program Officer, PG Coordinators Dr. Chitra Devi and Dr. Surekha, faculties, and my dear students to the COVID-19 vaccination awareness program organized by the NSS unit of the Oxford College of Business Management. In these testing times, when the disastrous COVID-19 has hit us globally and the threat of the third wave is looming large, vaccination seems to be the only ray of hope. But as doubts, anxieties, and rumors are the byproducts of any disaster, a large number of Indians seem reluctant to be a part of the massive vaccination drive conducted by the Government of India. In such a scenario, it becomes necessary to provide assurance to the people by dispelling the myths and doubts regarding vaccination. To address the issue, today we have with us Professor Dr. A. Murthy, Consultant Rheumatologist, Honorary Associate Professor, University of Leicester and University Hospitals of Leicester, NHS Trust, UK. Professor Murthy is a Professor of Rheumatology at New Vision University, Georgia, and visiting International Professor at Dr. MGR Medical University, Chennai. Doctor Professor Dr. Murthy has graduated from India and is working in NHS for more than 24 years with extensive clinical, research, and teaching experience in rheumatology. Some of his works include diagnosis and management of Reynolds phenomenon, COVID-19 and ethnicity challenges in rheumatology, rheumatology or training experience across Europe, analysis of core competence. I would request our chief guest, Professor Dr. A. Murthy, consultant rheumatologist, to take over the session.
Thank you. Thank you very much for your kind introduction, and thank you very much for inviting me to this session. Hope you all hear me, and it's a great pleasure and honor to be here to present this meeting. I'm glad this institution initiated a program to raise the awareness of vaccination, particularly about the COVID-19. Next slide, please. So I made this talk just to give about the COVID pandemic as an overview, and also going to talk about the vaccination, not scientific background, but general background about vaccination. And I would like to be delighted to take some questions at the end of this session. Next one, please. Click again, please. The COVID-19 is a disease caused by a novel coronavirus called SARS-CoV-2. The SARS stands for Severe Acute Respiratory Syndrome. This is a virus which causes severe acute respiratory syndrome. Next slide, please. There are many types of COVID viruses or coronaviruses. Some of the viruses typically affect the lung and the throats. These illnesses cause simple flu-like illness to more severe form of diseases, particularly pneumonia. That is one of the dreadful condition which can affect patients' breathing and also lead on to respiratory failure and death. Next one, please. Yep, you can move. The virus, how it spreads. There is a lot of dispute about how this virus is going to spread. And you can see that there are a lot of media interest about this. Particularly, this virus spreads by droplets, which means when you cough or sneeze, it can still present in the air. And when you touch it, you can get the infection. Some people have severe form of the disease, whereas few of them do get the disease, but does not manifest any symptoms and signs of these COVID-19 infections. It's still very, very difficult for us to identify why some people have severe form of COVID, some people doesn't get much severe form. So this virus attacks different population differently, and even in same group of population, it attacks differently too. Next one, please. So the global cases keep on increasing. The one on the top is number of cases in United States, and the next one is in India. And you can see in United Kingdom, about 127,981 died due to COVID, when compared to the population or the cases infected. So it's badly hit in United Kingdom. The next one, please. You can see how the numbers of cases are increasing from this graph. The red one is in England or United Kingdom, and the yellow one is in India, and the middle one is in Brazil. You can see that in England that the wave is flattened, whereas in India it's keep going up. This is recent data from World Health Organization. So though we are talking about the second wave is coming out, still the numbers are going up. Next one, please. So COVID-19 as such, there are lots of unanswered questions on COVID-19. Why it attacked and how it attacking, why somebody is dying, somebody is recovering very quick, etc. And what is the treatment? We're still not able to identify them. Next one, please. So the symptom, what we need to aware of that one, which is, I know this is a general audience which we are talking about, because the COVID-19 virus attack particularly into the lung or the respiratory tract, which starts from the nose and it goes up into the lungs. So when you start mouth breathing, the cough will come out, and then it's just, if the air or the cold air flowing towards the lung, it irritate the throat and lung and tickly cough and usually pass on the infection on and on. The next one, please. So what we need to avoid this one is, your fan or air condition is not recommended due to risk of spreading infection, particularly when you had this infection on board. So breathlessness, which is difficulty in breathing or difficulty in completing sentences when you're talking to somebody. So that's the first sign of COVID, when you start struggling to talk or communicate. So to get this better, as soon as you get the infection, everybody start doing some breathing exercises will also help them. Next one, please. Next slide, please. So what we need to do is, we need to breathe in, breathe out, breathe in, breathe out. You make this one quite a number of times. That will help you when you are infected with COVID. So the breathing exercises are the yoga in form of a breathing exercise to the lung is a better way of improving the COVID-19 infection. Next one, please. So you need to have a control of your breathing for 20 to 30 seconds. That means you don't breathe, and then 3 to 4 deep breath if you take, and then breathing control again, and then take a deep breath, breathing control and huffing, followed by the same thing which you keep on doing. That will also help. So it's a pranayama exercise, which is also practice in yoga, which also help. The next one, please. So make sure you are sitting upright and comfortably. Take a slow and deep breath and gentle relaxed breathing for 20 to 30 seconds, and repeat steps and huff, which is a take slow deep breath through your lung, which might help you. The next one, please. The other symptoms of COVID, which we wanted to raise awareness in the general public, is fatigue. What is fatigue? Fatigue is you feel unrefreshed after adequate rest. Fatigue is very common after any viral infection. You get common cold, flu, you get more viral infection. But COVID gives an extreme fatigability. Usually it stays settled down in a couple of weeks or 4 weeks. Sometimes it may lasted long. Next slide, please. So when it lasts for long, there's a new terminology you may need to aware of, which is called long COVID-19, which is most people recover from COVID symptom, and some of them still getting what appear to be a long COVID-19 symptom if they have persistent fatigue for after 12 weeks of COVID-19 infection. It also gives multiple long-term complications. In England, we started setting up clinics for long COVID-19 symptom. Next slide, please. So the extreme tiredness, which I talked about, and shortness of breath, problems with memory and concentration, which is what we call brain fog after infection, and also difficulty in sleeping, palpitations, dizziness, and sometimes people may get some rash followed by this long COVID-19 infection. Next slide, please. They also gets what we call pins and needles, joint pain. That's why they come and consult rheumatologists. And they also get, because of the extreme fatigability, they do get depression, anxiety, and they have some diarrhea, loss of weight, loss of appetite, high temperature, sore throat, and change of smell and taste will persist after 12 weeks of things. How do we treat? This is only supportive treatment for this group of patients. In general, I'm just going to touch upon the next slide, please, about the treatment, various research are going on, which is one of the trial in England called Recovery Trial, which has enrolled a maximum number of COVID-19 patients during first wave, and England NHS health authorities came out with a specific recommendations. So the dexamethasone, or otherwise it's called as steroids, are useful, but they don't help in mild illness, only for severe illnesses. They prevent people going into ventilator. So that is one of the steroid myths on that one. The second one, please, next one. There is a lot of, because this is a condition whereby there is a lot of hyperinflammation developed during this infection. The virus goes in and develop lots of cytokine, which is mediated by what we call interleukin. So we have already a drug called interleukin 6 inhibitors, which is we used in England called REMCAP study, which did help. Obviously, it is called tocilizumab. It's quite an expensive drug, but it does help to prevent people dying from this COVID-19. Next one. But there are a lot of challenges in this condition. I'm touching upon because one of my research interests is in South Asian population affected by COVID. We found that disproportionate impact of South Asian patient group with this COVID-19. Next slide, please. So the other thing which you may need to understand is, which again our paper, the research paper which we published in beginning of this year, this disease is a disease of loneliness. A lot of people die on their own without seeing their family members next to them, or nobody would have been seen them even after death. So this is a disease of loneliness and solitary disease. Next one, please. See, the death rate in England, particularly when compared to the local population, it has been high when compared to the local white population. So there is some high risk of death among Asian descents living in England. Next click, please. So ethnicity, which is an increased rate, particularly Black Afro-Caribbean people, dying more than that. People of Bangladeshi and Pakistani and Indian origin also have significant rise risk involving COVID-19 compared with those of white ethnicity. Whereas comparing to India, we see complete disproportionate death in India and England. Next one, please. Next one, please. So in England, there's lots of healthcare workers died of COVID-19 over the first wave, and majority of them are Black, Asian, minority ethnic population. Next one, please. So we reviewed why that is a factor in the disproportionate health outcome in COVID-19. Next one, please. Yeah, click 3 clicks, please. So 2/3 of health workers in the NHS are predominantly ethnic minorities, and a lot of people have died of this condition due to the infection affecting disproportionately to that one particular race. And there is a link to the incidence and outcome of COVID-19 in different ethnic variations. So we sharpened the focus of ethnicity in the race of tone, and it also brought up the race equality in general population. Next one, please. So you could see that there is a widening disparity among patients with rheumatic diseases also. This is our own group of patients. We published a few papers on the spotlights on global rheumatology issues in developing and developed countries, and also because we treat a lot of patients with COVID-19 with lots of immunosuppressive treatment. There's a huge challenges. Next one, please. So we understand this is a disease which has a lot of unique challenges. It affects in different parts of the world differently. and it also attack different race differently as well. So what we now got is a vaccination. Vaccination is the only way out of this pandemic. Next slides, please. Next one. So what is vaccine? So the vaccine is basically create some sort of protection in our body cell. So this virus is having lot of spikes around. This is the shape of this coronavirus predicted by the genomic model. And what we identified is a lot of spike proteins. These spike proteins mutate or change. That's why we have alpha, beta, delta viruses nowadays. But what this vaccine does is this vaccine creates some sort of a block around the spike protein by which when the virus comes, these spike protein blockers will not allow them to get into the body. So that is what the vaccine does. We have vaccination for various diseases, obviously starting from smallpox to even for typhoid, we got vaccination. And some of them completely eradicated the disease in the globe. So one of the example is smallpox, which we don't see smallpox anymore in any part of the world because smallpox vaccination completely done. So similar to that, during this COVID-19, with a rapid phase, the scientists and the researchers identified with some models through the artificial intelligence, genomic model, and the gene technology identified this vaccine. And we got a lot of vaccine now available for our disposal to use. Next slide, please. So what this vaccine does, I'm not going into the deep knowledge about the vaccine. What we all understand is the body has a couple of cells which will produce immune system or immunity against anything. So what is immunity is when you have some small army inside your body. That means any foreign things comes into your body, it will reject it. So that is immune system. So we all have that sort of called a defense mechanism in our body, mediated by these sort of cells called T cells and B cells. And there are some cells called memory cells in the body. So the vaccine applies, which will keep the memory of that particular virus in our body. So whenever this body comes, this virus attacking us, this will reject, this immune system reject. You can achieve this by only getting vaccination or you had already got a COVID-19 infection. So that's where we are all talking about the herd immunity, etc. Next one, please. So there is a vaccine available and there is a prioritization of vaccine. Who gets vaccination? Anybody with the age of 18 or over should get vaccination. People at high risk from COVID-19, which is those disease or clinically vulnerable group of patients, should get the vaccine immediately. People with condition and puts them at high risk, clinically vulnerable group. People with learning disability. That is another huge challenge, and even for people with learning disability, mental health illness are not coming and getting vaccination. Are people living on their own or in a care home or in a social care setting or important group of people. The clinically vulnerable group which I'm talking about is those who had kidney transplant or liver transplant. These people are high risk of COVID-19, and those who had previous cancer, those had severe asthma or severe lung condition, or those who are already on immunosuppressive treatment, including steroids, and also patient require long-term dialysis for kidney failure. These are the people should be vaccinated. In England, what we did was we target this first group of patients with vaccination. And first, initially, we shielded them. That means they don't come out from their home and all the supports are provided to these people. So we shielded them. They are not coming out into the community or public. So we prevented them to get infection in the first place. And then we applied these or gave vaccination to them. And now they are slowly coming out. So they are protected. So this is what we need to do, the clinically vulnerable group of patients to be vaccinated irrespective of anything, because their defense mechanism is very poor. So vaccine is the key to help them. Next one, please. There are various vaccines available, which I'm not going to go into the mechanism of that vaccine. You all know about this Covishield, which is AstraZeneca vaccine, which is what we as an England research are proud about it, which has been manufactured in India, and it is from the AstraZeneca Oxford vaccine. And the Covaxin is from the Bharat Biotech, and there is Russian vaccines coming as Sputnik. I mean, in England, there are some more vaccines are available called Moderna and Pfizer vaccines, and each vaccines work differently. We are not going to talk about that. Go for it. Next one, please. So people need to understand the problem with COVID first, and then they need to understand how can I protect myself. That's where they need to understand the benefit of vaccine. The benefit of vaccine is it will significantly reduce the risk of getting seriously ill. What it means is you can still get COVID-19, but you won't get significantly serious illness with this COVID-19. The most importantly, the vaccination reduces the risk of dying from COVID-19. What the data showing is those who has got vaccination, the death rate among those vaccinated group is far and few. They get infection, but the death rate is poor, so small, and also they won't get seriously ill. And they may get COVID-19, but they don't manifest symptoms of COVID-19 because they had vaccination. They can catch the infection, but they cannot spread this they spread this virus into other people. So these are the key fundamental principle of vaccination as a general public, non-medical people need to understand. So it significantly reduces your risk of getting serious illness, reduce the risk of dying from COVID-19, reduce the risk of getting symptoms of COVID-19, and also reduce the risk of catching and spreading this into another population, another people, elderly people living in your house, or young people living in your house. You may prevent spreading that virus. So that is why we all need to take vaccine. Of course, people are worried about the side effects, particularly when you get the vaccine, you may get sore arm from the injection for a week or two, but it will settle down. You may feel tired after the vaccine, nothing to worry about it. You may get headaches, but if you are getting this following symptom, you seek help. That is, after 4 days to 4 weeks. That's what we say to here. When you get severe headache, which is not helped by paracetamol, or severe headaches, which is lying down or bending over, or associated with blurred vision, nausea and vomiting, or weakness, drowsiness, or some sort of a seizures or fits, unexplained bleeding in the skin, or shortness of breath, chest pain, or abdominal pain. This is particularly about the Covishield as well as Covaxin. So if anybody got these things, then they need to go and get these things. So why these people need to get the vaccines? I'm just categorizing in different age group. I know I'm talking about the group which is very younger group, but what we need to understand, anybody 50 and above, you can see that there is very high chance of hospitalization if they got vaccinated, if they got infected. And they get long COVID is also common, and catching and spreading infection. So the first dose of vaccine reduce 80% of infection or reduction in death. And if you have both doses, then it is 95% reduction in death. So that is why we need to take the vaccine. Next slide. Coming into 40 to 49 years of age, they don't come into hospital that much, but they have a moderate risk. And again, the first dose and second dose, the benefit is 80 to 95%. So each individual, it may vary, but overall, you get 75% above. No vaccine is 100% protective or 100% safe, but it will give benefit, which is around 75 to 100%. Okay, next one, please. As the age goes on, the first dose and second dose, we need to keep moving forward on that one. The next one. This is the age group which I was told that I'm talking about. So very high chance of catching and spreading infection. That is the group which is 18 to 29 or 30 are easily, because they move around and they don't have any comorbid condition or other diseases, they get more. And then they also getting more long COVID, and they don't get hospital. They don't come into hospital. They don't get into intensive care or death. This is very low in this kind of age group. However, if you got both doses of vaccination in this age group, 85 to 90% benefit out of getting COVID-19. So what do you prevent? You prevent death. You also prevent the symptom which I talked about earlier on called long COVID. Now, this is the people, those who menstruating or menstrual cycle going on. And there's a lot of news around fertility and also the periods, monthly cycle can get affected by vaccination. Yes, it can be, but it is by chance. Not everybody get these sort of problems. So be reassured, women, particularly in this age group, and the monthly cycles can miss, but nothing to worry about it, but it will come back on a normal. This is again from the Royal College of Obstetrician Gynecologist. So how we did in England, the coronavirus vaccine. This is uploaded only on 20th. We managed to give lots of vaccination. If you can see that one, second dose is almost half the population in England has had vaccination of both doses. The first dose is around 70%. When compared to globally, we in England, we were going rapid phase. Even in first doses globally, admits only 21.7%. Second dose is around 10%. In England, we got 50 and around 70 to 80. The next slide. And this is by each day now. From since then, the second dose is around 60 and the first dose around 81. The plan is to get all the people in July to get vaccinated, at least one dose. So what it does, it will produce what we call herd immunity. So we all need to get the vaccination as soon as possible to create the community protection or the community where we live. Come into the next slide, please. So vaccination in India, it's a problem. As the introduction we mentioned about, this vaccination rate, if you can see that India is around 16.8% on the 2 doses and only first dose is around 3.7. So it is very poor, around 20.58% when comparing to Hong Kong, it is double, and England even better. So the more you get the vaccination, we will be getting more herd immunity. So what's the reason behind that? It's called vaccine hesitancy. So vaccine hesitancy is called, you offer a vaccine, they delay in accepting the vaccine, or they may be reluctant to take the vaccine, or they may refuse to take the vaccine despite you give them vaccine. So that is called vaccine hesitancy. This is the topmost priority in the World Health Organization now, because this is the top of the first of the 10th of World Health Organization global health challenges. It is not only in India, it's worldwide issue by which this vaccine hesitancy is a key problem. It's a key challenge for any healthcare workers. I'm glad your university is doing this program to raise awareness of vaccination, why we need to take vaccine, how do we take vaccine, and also try to demystify the myths of vaccination. Next slide, please. So there are lots of factors has been published in various papers. We also published about the vaccine hesitancy in Asian population in England. Next one, please. So the hesitancy results from a complex decision-making process. When we are all living in a combined family or a cultural belief, then there is a problem, because one may say, no, don't take it. Some may say, yeah, I had the vaccine, I had a bad experience. And it's also influenced by individual or group or very specific vaccine factors. Unfortunately, there is a lot of bad media coverage as well. So communication in media has a key role, and that's why now the media started promoting the vaccination. And there is a lot of historical influences, which I'm talking about. Even when we started these smallpox vaccine, a lot of people were hesitant to take the vaccine. That's due to, female or male gender, or even the socioeconomic status. A lot of politics around that one, and there's a geographical barrier. It is not only in India, I'm talking about overall. And the problem is vaccination experience. People don't share the good experience. They always share the bad experience of vaccination and the perception around this one, which is also going to affect. So the design of the vaccine program is also different. Some places they vaccinate the elderly and vulnerable group. Some places the vaccination program is not been properly designed so that people may not able to get the vaccine, though they are willing to take vaccine. Next one, please. So there is a global trend. Next one. And various papers has been published about the vaccine hesitancy. Even in healthcare workers, we worked around the doctors, and the doctors are happy to take. However, the healthcare workers, I mean the persons working in the hospitals like porters, other workers, are still reluctant to take the vaccine, despite they know that they are at a risk of. This is a paper come from Maldives and Maltese population. There's a hesitancy among the healthcare workers. So what we in England did was all the healthcare workers did the vaccine first and then propagated into the public, organizing social events and told them that we took the vaccine, nothing happened, please go and take the vaccine. So the vaccine drive was mediated by healthcare professionals more actively. Next one, please. Next one, please. So there are lots of emerging vaccines, and that's again particular specific diseases having some challenges. We published around that one because lots of new vaccine coming up, and people always have their issues because they already have the immunosuppressive treatment, whether they can take the vaccine or not. Next one, please. And this is the key problem in England, which is published now last month, Covid-19 vaccine hesitancy among ethnic minority groups. Again, there's a cultural belief, poor understanding, and also here it is available, but they don't want to take it. So there's lots of drive going on, educating, promoting, even through Bollywood actors, they are going to promote that one more, asking them to take vaccination. Next one, please. So the vaccine, people also worried about it as, yeah, the first vaccine I took it's helped. Will it help for the modified or mutated viruses? Yes, of course. This is a paper, it's not published, it's just on press. It's been, the research came from England. We have now the Delta variant, which is the Indian variant, and the research came from Oxford. And what they're saying is this does work for the mutated vaccine. So it's important you get the vaccine straight away. So it will only protect the current vaccine. Any future strain also, this will help. This is due to the advance in genetic engineering by which they identify the protein. So whichever comes, it will block. Next one, please. So where is the future? The future is, we all know that we are all living with uncertainty. That is a problem. We all worried about the COVID start with. We all worried about the lockdown. We are all worried about the vaccine. This COVID brought up a lot of uncertainty in life. However, we need to reflect and we need to share our experiences. That's the whole idea of this meeting, which I presume members will share their views. And also you need to improve your personal care and also the other patient welfare. Because if you don't vaccinated, you may spread into other people who is already at a high risk. So please take vaccine for improving your personal and also other patient welfare. I'll stop here and I'm more happy to take any questions. I'm sorry I have technical problem with it. Thank you.
Thank you so much, Professor Dr. Mutri, for giving us a clear and better understanding on COVID-19 vaccination. I request participants to come forward and put across your questions and discuss it with Professor Dr. A. Murthy.
Good afternoon, sir.
Good afternoon.
Sir, I heard one thing, that is consuming steroid content will cause for the black fungus. Is it true, sir?
Yeah, the steroids are being used for a number of years. Yes. We as rheumatologists, we've been using steroids in very, very high dose. Yeah, normally when you get it, the steroid dose, which for asthma or something else, they'll give 10 milligram. I give my patients up to 1 gram. Yeah, 100 times more than what they are normally taking. So when you are taking steroid, whether you have COVID or a pandemic or not, they are at high risk of any additional infection, which is either bacterial infection or viral infection, or in that matter, a fungal infection. The fungal infection which you're talking about is the mucormycosis, which is the fungus which attacks the eyes. These steroids will enable them to get these infection, and this is particularly high. We already got some immunocompromise due to COVID-19. So steroid is one of the contributory factor, and COVID is another one, and diabetes is another one which can cause these risk of developing the fungal infection. Bear in mind, in England, we don't see much of mucormycosis. Does that answer your question?
Yes. Thank you, sir.
Thank you.
Any other participant would like to ask a question?
Good evening, sir. This is Sanjana.
Hello.
Are there any medicines which shouldn't be consumed after taking the vaccines, which can be fatal?
We normally don't advise anything. They should be taking their normal medicine as before. There are some medicine which we use in rheumatology, particularly very highly immunosuppressed medication. We advise them to defer for 2 weeks or so. But if you are on high blood pressure medication or diabetes medication, you should continue to take it. You shouldn't stop because you had vaccine. Vaccine doesn't give you any side effects or interaction with this medication which we are taking. So it's free to take and allowed to take all the time. Yeah.
Thank you, sir.
Thank you.
So there's a question in the chat box. COVID shield or COVID vaccine, which is better?
Very interesting question. Obviously, I'm talking to an Indian audience here. The COVID shield is called AstraZeneca Oxford vaccine. We are all believe in scientific research and the outcome. The COVID shield has came out. It's used what we call live vector. Yeah. And this vaccine has developed, designed, and also tested in multiple stages of clinical trials. And before it has been given to it has been tested and also given human and then tested, and then only it's been authorized and approved. So we are comfortable to say that it is a safe medication to take. Whereas the Covaxin, they approved in a very rapid pattern when there is not much safety data available. So as a scientist, as a researcher, if there is two data are given to me, I would like to look into the way which the research studies are done. And I would say Covishield is better than Covaxin because I have more data about Covishield rather than Covaxin. If I see more data from Covaxin, the safety, then I may say differently. But so far, I haven't seen much data from Covaxin. That's why we advocate everybody to take Covishield. Of course, Covishield have some side effects, particularly some clotting problems or bleeding can happen, but not everybody get it. It's very, very few in number. And it is also sometimes common in less than 30 years of age. They are talking about in England. So in England, the Covishield, they say if you have any reaction in the first dose, then they don't administer the second dose, and they may give the alternative medications, alternative vaccine. But Covishield is better, which is available vaccine in India. Is it clear?
Oh, thank you, sir. So can you hear me?
Yeah, I can.
Yes, sir. So I have taken vaccination.
Yeah.
Whereas at my home, kids are there, where they're below 5 years. But I'm working in I'm working in a college, whereas I'm coming out and going home. Maybe because of vaccination, it may not be affect or it may affect for me. But is there a chances of getting my kid through me?
Yeah, the children are less likely to get COVID-19 infection. The reason behind that is because the COVID-19 virus will go and attach a receptor or something called angiotensin converting enzyme receptor, ACE inhibitors, which is predominantly present in the nose up to the lung. This is not developed, that particular receptor, in young people, yeah, which I'm talking about less than 10 or 12 years of age group. They don't have a receptor, so it doesn't come and bind with the receptor. That's why the young people are less risk of developing COVID infection. Of course, when you are coming after having vaccination, your chance of transmitting to other people is also reduced. So yes, it will give protection for your children or other people, so by you don't transmit your infection or your virus to other people if you have COVID vaccine already on board. Okay.
Thank you, sir.
So there's one more question by Nafisa Fazil. Can we take vaccine if we have thyroid?
Yes, a thyroid problem doesn't exclude you not taking vaccine. You can take vaccine. The only reason which they are now talking about vaccine is if you have severe allergic reaction. Yeah, I mean, severe allergic reaction is, for example, you may completely stop breathing or having complication, require hospital admission with allergic reactions. That is the patient group which we are trying to avoid. And most of the people, they are giving vaccine and they are monitoring them while they are receiving vaccine for 15 minutes to half an hour in the hospital. So we have not seen anybody die of vaccine complication so far. So it is safe. Diabetes can take, high blood pressure patients can take, thyroid patients can take too.
Okay, sir. If anybody else would like to ask a question?
So can I ask one more question, sir?
Yes, please.
Sir, since we are all moving for a vaccination, everybody started taking vaccination, the percentage also is increased, right? Then why still we are talking about like a third wave is going to hit majorly, all that? Is it really true, or like that they're creating awareness, like, or they're creating that the people has to come over for to take a vaccination?
Yeah, we are now in the middle of a pandemic, not epidemic. Pandemic is global. So the The model, the epidemiological model, designed by previous experiences in flu pandemic or plague pandemic long time ago, what it is this comes in waves. The wave can stop once the community acquired complete protection or herd immunity. To get herd immunity, you need 90% of population or 85% of population to be vaccinated. So that's one of the reasons in England, they delayed the second vaccine and then give vaccine to everybody and one dose, so that 80% of the population now had vaccination. Despite that, in England, we are predicted a third wave coming up in July, end of July or August. So this is where it comes. Each wave comes and then the final wave die off, provided we are all took the vaccine and then protect us and protect the community. That's where the vaccination drive is very important. And people, I mean, obviously availability is another issue. We may not get to the big countries like in India, we may have some vaccine shortage, but the wave is predicted and it is true.
So there's another question from Ashok MS. After I recovered from COVID-19, BBMP officers informed me to take vaccine only after 3 months. Why?
Yeah, that's a good question. The scientific research is what we are saying, that you should be able to get vaccine after 4 weeks of infection. That means when you had the first symptoms of COVID or you completely tested positive by PCR, and then 4 weeks from then, you are allowed to take vaccine in England. That is the protocol. The India and other places, they say it's 3 months. That is purely due to the lack of availability of vaccination. The belief is when you get a COVID-19 vaccine,